Today we're going to talk about Medicare and travel coverage, so stay tuned. Hey, Mark Garrett here with National Senior Savings. Today I wanted to talk to you about travel and Medicare. What are your options? So first off, Medicare really breaks down to three possible ways you're utilizing it. You either have original Medicare, which is Part A and Part B, and you purchased a prescription drug plan separately. You have a Medicare Advantage plan, which includes your Part A and your Part B, and also a prescription drug plan most of the time. Or you might have a Medicare Supplement with a prescription drug plan. So let's talk about all three. So with original Medicare, if you have nothing to go along with it, you are allowed to go anywhere in the United States and you can see any doctor. You can go to any facility that accepts Medicare, which is 96% or better of the medical community. If you have a Medicare Advantage plan, that's a little bit different. So with a Medicare Advantage plan, there are two basic plans most people go with. One is a PPO and one is an HMO. So let's go first with the HMO because it's the easiest to break down. So with the HMO, you have to stay within your network of doctors and providers in your local area. It's usually within a couple of a county region or within a certain city, sometimes within the state. But typically speaking, your network is going to be people that are close, facilities and doctors that are close to where you live. With the HMO, if you did travel, let's say you had a cousin who lived 5 states away and you had an emergent situation, all plans have to cover emergency services and urgent care services, but you wouldn't be able with an HMO to set up another primary care physician in another location. You would only be able to do that where you lived. Then you have the PPO. So with the PPO, it allows you to go to most any doctor you want to go to, and that includes doctors that are out of state. The one thing that you have to keep in mind with the PPO, though, is PPOs also have doctors that are in network for that particular company that you have your Medicare Advantage plan with. For example, if you went to a doctor that was 5 states away and that doctor was not in your network, of course the plan's going to pay for it because it's a PPO. It allowed you to go to that doctor, but it doesn't pay the full benefit that it would pay if you had seen one of the doctors in network locally in your state or your region, wherever you got the PPO. So PPOs do offer you additional services when you go out of the network, but they also usually have a copay to go along with it. Real important to keep in mind, if you move out of your service area for over 6 months, a majority of the time, those plans are going to cancel you and you'll either be eligible for a special enrollment period or you can just go back to original Medicare where you're at. But there are some plans that will let you travel 12 months out of the year. You just have to look at your particular Medicare Advantage plan to see which part applies to you. Then you have Medicare Supplements. The last thing we're going to talk about is a supplement. Supplements are great because they're Medigap policies. They just pay whatever Medicare doesn't. So just pretend you have original Medicare, Part A and Part B, which you do, and you can go to any doctor you want to, which you can, that accepts Medicare, and the Medigap plan is going to pay the difference. So Medicare Supplements allow for you to travel to other locations in the country and use a primary care physician in that location. So if you're someone who travels a lot, that's a really key factor that you need to be aware of, is Medicare Supplements give you the most diversity on what you can do. Several of the Medicare Supplement plans like Plan F, Plan G, Plan N, they allow for foreign travel. So they have a amount, certain out of pocket, that if you went overseas to a different country, South America, Africa, Europe, Asia, Australia, if you went to any of these countries and you needed help, Medicare is not going to pay, but a Medicare Supplement plan, if you chose the right one, will pay a portion of your overseas cost for your health care if you had an emergent situation. I hope this pretty much puts it all in perspective for you, that with original Medicare and Medicare Supplements, you have the most opportunity for travel. With Medicare Advantage Plans HMO, you have the least opportunity for travel. And with a PPO, you do have the opportunity, but it is somewhat limited and you need to look at the restrictions on your plan before you go. Once again, I'm Mark Garrett. Please go to our site at nationalseniorsavings.com. We have a lot of educational resources on there for you. Our phone number is 800-708-5810. We look forward to hearing from you. Have a great day.